Dr. Ghatan, I would like to talk to you about aging spots, brown spots, whatever they are called. They appear in the face, where they are unsightly, and they appear in the hands, all over the body. But the front of the hands and the face is definitely where they become unsightly. So, what can be done, if at all?
Well, there's plenty to be done nowadays, and people call this sometimes liver spots or sunspots. Yes. They're basically from sun exposure, and nothing to do with liver disease, has nothing to do with the liver problems. And the hands, you tell them it's probably from wearing the carriage years back, and they got sun exposure there. So the laser would be the best treatment for the sunspots, which we call them lenticles. Most of the time, one-time laser treatment will remove the spots. The thing is, you don't want to do too many of them at one time because you want to give a chance for the patient to heal. So it may take a few sessions to take care of the face and the hands, but the results are dramatic.
Okay. So let me ask you. Once you take them off, do they rather fast come back, or it then takes again long time for other ones to develop on an average? I mean, as a person gets older, we obviously, apparently, most people seem to be getting more of them. But so if one removes a few of them, are they then kind of removed forever, and new one would have to develop in order to have again some? What's the deal there?
Well, that's a good question, and there are a few things. First of all, the ones that are removed, for the most part, are gone for good.
Okay.
And I tell the patients, look, you're going to see these are gone, but you're going to start noticing the lighter ones that we didn't do yet, and they're going to stand out. So then we're going to take care of them if you wish so. But there is a damage that has been done, say 20, 30 years ago, or 10 years ago, and the damage is going to appear slowly. So you may take care of these today, and maybe in a year or two you may come up with a few more dots and spots on your hand or face, but these are the results of what you had a couple of years ago. So they're coming out now. But for the most part, when we do, it's gone. It's finished.
And again, you said you're using lasers for that. So on an average, a couple, 2-3 treatment will do the trick to get rid of most of them?
Most of the time, each spot can be removed with one treatment. If a patient has a lot of spots, say you have hundreds of spots, then it's a good idea to do maybe say 20, 25 of them in one session, and then divide them up over the next few weeks. This way, it's safer and it's better for the patient.
I see. So basically, what you're saying, a person who has a dozen or two, most likely it's one set of treatment, and he's out of there again.
Yes.
And can he be social immediately, or does he have to hide for a few days?
Most of the time what happens is that these brown spots become darker, and then over the next few days they fall off. There may be some pinkish discoloration, which goes away within a week or two. And that's one of the other reasons we don't do too many of them in one day, because this way they don't have to hide, they don't have to they will still be able to go to work and do whatever they have to do. So it's good to do a little bit at a time. It shouldn't interfere with their life and social life, etc. And at the same time, they heal better.
Wonderful. Again, thank you very much. Very informative. I'm sure helps a lots of people to make decisions to, get prettier, I guess. Thank you very much.